do you know if your loved one is using drugs? Hello, welcome to this module to understand how to recognize if someone in your family or friends are using drugs. I'm Dr. McIntosh from Eden Addictions Treatment Centre and Tough Minds Life Rescue Program. And I've been working in this field for many years and understand the devastating effects drugs and alcohol use can have on an individual as well as everyone around them, especially with the people they love. We run community and residential rehabilitation services in Australia and overseas, so regularly help people get clean and achieve successful recovery. So please understand that recovery is possible and that it does happen. There are three broad areas to consider when looking for signs for substance misuse, and these are physical signs, emotional or behavioural signs, and drug tests that can be done. So let's go through the physical signs that you need to watch for. So pay attention for their physical appearance, that they are not looking after themselves, or perhaps they're not washing or shaving or brushing their hair. Maybe they're wearing dirty clothes or not caring about their appearance in general. Are there stains on their clothes from cigarettes, maybe burns, blood, or vomit? Obviously, as time passes, all these signs become more severe and in the early stages might be quite subtle. The next physical sign is to pay attention to their eyes, which may be bloodshot, bleary, glazed, or unfocused. Maybe they appear vacant at times, as if they're not really with you, or they could be very wide-eyed and very agitated. They may smell unusual too, sometimes directly from drug use, like cannabis or alcohol, or from lack of personal hygiene. Rotten teeth and drug use also are a cause of bad breath. So look out for this one. Drugs that you snort through the nose can cause irritation into the lining of the nose, so it can also cause bleeding, discharge, runny nose, or constant sniffing. So that's another thing to look out for. Injecting drugs causes skin sores, wounds, and infections. What you'll see are pinprick wounds, bruising, redness, irritation, and possibly infections or ulcers of the skin, usually on the arms. Some drugs also cause widespread ulceration of the skin, like ice. Drug users will often keep their skin covered if they have scars to hide, their injection sites, so pay attention if this keeps occurring. Withdrawal symptoms may be noticed at times like shaking, sweating, irritability, and restlessness. The person becomes agitated and seems to have difficulty focusing and cannot settle, as if they're looking for their next hit. There may be also signs of watery eyes, sneezing, coughing, vomiting, or diarrhea. These can occur within a few hours of their last use and will go away when they have their next use. The next broad area to consider are emotional behaviour and social signs that you may see. The most obvious and often the most important change is the loss of brain function. So what you will notice is a falling off of school grades or work issues, and possibly the loss of employment. Along the same lines, you'll notice unusual sleep and energy patterns. The person may change from having excessive energy and being, say, up all night or even for days, and then crashing and having prolonged time in bed. Moral and attitude changes occur where life's normal standards can be lost in the drive to have their next hit. And if this requires stealing, violence, or lying, it will be done because the need of the drug is so great. This loses friends, family, and trust, and drives people apart. The other thing to open your eyes to is to see if there's any drug use items around. These would be items like cigarette paper, pipes, bongs, syringes, needles, medication bottles, eye drops, air freshener, and incense. These are not all incriminating, but pay attention for these signs in any case. The last area to discuss is the ability to perform drug testing. This is the most easily done as a urine test, but can also be performed as blood tests through your doctor. Any tests need to be performed randomly, as there are ways to get the test to be negative, and some drugs clear out of the system very fast. They also need to be done with the consent of the person, and they will usually refuse to consent if they know it will be positive. Remember that some people can be very good at hiding their drug use, and some continue to function in society while using regularly, and they make sure that the signs are not visible. However, as the addiction and the use increases, the interference with life gets worse and the signs become more obvious. The sooner that the person is recognized and addressed, the easier it is to control. So get in early and help your addicted person in need. Hopefully this information has helped you understand the main things to look for. And if you want a free download and a full version of how to manage a family member who is using drugs, please click here. If you want any further advice on drug rehabilitation programs, you can call me, Dr. Ellie McIntosh, on 0429 430 739. Thank you very much for watching. I hope this has been beneficial to you.